The Navigator works with the patients, specifically the breast cancer patients in my case, from diagnosis, definitive diagnosis, through surgery and through treatment to survivorship. I'm basically the emotional support and the resource support, sort of the cog in the wheel in the system. I don't provide medical information, but I help them get that information if they need it, and basically just the emotional support. I was diagnosed on a Thursday. I had my surgery the next Thursday, and I was overwhelmed with the choices. And I come from a medical family. I have great resources and friends here in the community, and I just felt like, if I have all of these questions, what must it be like if you don't have those resources? I felt that the patients needed that Navigator. It's a relatively new field, and I had heard about it from other places that I'd visited, and I just really felt like it needed to be part of our new center. So I sort of lobbied for the position to be in place, not really meaning for it to be me at first, but that's how it ended up, and I love my job, and I'm so grateful to be doing it. But I felt like I needed someone to be able to ask those questions to that were non-medical. And the beauty of it is that I have the time to spend with the patients. You know, the doctor has so many patients to see, but I can spend an hour talking to them and just trying to make them comfortable. Maybe in their first chemo, I know how that feels. We have great support systems, nurses, dietitians, social workers across the board who all work together as a family to treat the patient. And I was very lucky to have my care here. I would not have gone anywhere else. We are so lucky in our new facility to have the integrative services of radiation oncology and medical oncology under one roof. That doesn't happen everywhere, and that is a great plus in our new facility. We also have the integrative services, as I said, of a dietitian, social workers, all working together to help the patient. And I think the multidisciplinary approach is the best approach. And we have a weekly tumor board where our physicians all meet and assess the needs of the patient, coming together to a mutual diagnosis for the best of the patient. So you have everybody in one room, in person, live and in person, hearing the case, looking at the slides, talking to the pathologist, talking to the radiologist. As a Navigator, I attend the tumor board meetings if they're pertinent breast cancer cases, not really providing any input, but of great help to me to see the needs of the patient, to see their pathology, to be more familiar with them. It helps me a lot as I deal with them. So, and I'll become aware of the cases and be able to talk to the doctors about them afterwards. So it really helps.